Hi and welcome back to another video of Medic Notes. This video is on anterior cruciate ligament tear. For introduction, an anterior cruciate ligament tear is a common injury to the knee joint. The ACL is an important stabilizer of the knee joint, being the primary restraint to limit anterior translation of the tibia, and also contributing to knee rotational stability. This picture shows the ligaments and meniscus in the knee joint. The blue color is the anterior cruciate ligament. For clinical features, an ACL tear typically occurs in an athlete with a history of twisting the knee whilst weight-bearing. The patient is usually unable to weight-bear. They will typically present with a rapid joint swelling and significant pain. If the presentation is delayed, instability may also be evident, in which the patient describes the leg as giving way. The specific clinical tests that can identify potential ACL damage are the Lachman test and anterior draw test. The differential diagnosis include proximal tibialar or distal femur fracture, a meniscal tear, collateral ligament tear, or a quadriceps tendon or patellar ligament tear. For investigations, a plain film radiograph of the knee, in AP and lateral views, should be taken to exclude bone injuries, or any joint effusion. An MRI scan of the knee is gold standard to confirm the diagnosis. This is an MRI scan demonstrating a tear to the ACL. For management, the immediate management of a suspected ACL tear is rest, ice, compression, and elevation. The specific treatment of an ACL rupture can be either conservative or surgical. Conservative treatment involves rehabilitation and quadriceps muscle strengthening, whereas for surgical reconstruction of the ACL involves the use of a tendon or an artificial graft. The complications include post-traumatic osteoarthritis. That's all for this video. Thank you.